Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery respiratory system part 3. In the current session we will be discussing about larynx and the CPT range is 31300 to 31599. First of all, coming to larynx, it is again divided into excision, introduction, endoscopy, repair and other procedures. The CPT range for excision is 31300 to 31420 and for introduction it is 31500 and 31502 and for endoscopy the CPT range is 31505 to 31579 and for repair it is 31580 to 31592. Under repair only we will find some out of numerical sequence codes. They are 31551 and 31554. They are included under the repair only. Though the repair CPT starts from 31580, these CPTs are included here, 31551 to 31554. And finally, other procedures, there is only one CPT, that is 31599. First of all, coming to excision, the first CPT is 31300. It deals with laryngotomy, which includes thyrotomy or laryngofissure, with removal of tumor or laryngoscele, chordectomy, and also chordectomy. The next CPT is 31360. It deals with laryngectomy, total, without radical neck dissection. The next is 31365. It deals with laryngectomy, total, with radical neck dissection. Previously it is without, now it is with radical neck dissection. The next is 31367. It deals with laryngectomy, subtotal, supraglottic without radical neck dissection. The next is 31368. It deals with laryngectomy, subtotal, supraglottic with radical neck dissection. The next CPT is 31370. It deals with partial laryngectomy or hemilaryngectomy horizontal. The next CPT is 31375. It deals with partial laryngectomy lateroventricular. Previously it is horizontal, now it is lateroventricular. The next is 31380. If partial laryngectomy is performed anterioventricle, then the CPT is 31380. If it is anterolateroventricle, then the CPT is 31382. The next CPT is 31390. It deals with pharyngolaryngectomy with radical neck dissection without reconstruction. If it is performed with reconstruction, the CPT is 31395. The next CPT is 31400. It deals with arytenoidectomy or arytenoidopexy, external approach. And for endoscopic arytenoidectomy, you need to use 31560. The next CPT is 31420. It deals with epiglottidectomy. The next topic is introduction. The first CPT is 31500. It deals with intubation, endotracheal emergency procedure. If intubation, endotracheal is performed in an emergency situation, the CPT is 31500. The next CPT is 31502. Tracheotomy tube change prior to establishment of fistula tract. Now let us see an example. A physician performs an endotracheal intubation to save the patient's life. So the CPT is 31500. Intubation endotracheal emergency procedure. Next topic is endoscopy. And for endoscopic procedures, report appropriate endoscopy of each anatomical site examined. Laryngoscopy includes examination of tongue base, larynx and hypopharynx. The anatomic structures examined with this procedure include both midline, that is single anatomical site, and paired structures. Midline single anatomical sites include tongue base, valleculae, epiglottis, subglottis and posterior pharyngeal wall. And the paired structures include vocal cords, arytenoids, false vocal cords, ventricles, pyriform sinuses and array epiglottic folds. And for the purpose of reporting therapeutic interventions, all paired structures contained within one side of larynx or pharynx are considered unilateral. This is an important point. For the purpose of reporting therapeutic interventions, all paled structures contained within one side of larynx are considered unilateral. If using operating microscope, telescope or both, use the applicable code only once per operative session. Now coming to the first CPT, that is 31505. It deals with laryngoscopy, indirect diagnostic. The next is 31510, laryngoscopy with biopsy. The next is 31511, laryngoscopy with removal of foreign body. The next is 31512. It deals with laryngoscopy with removal of lesion. The next is 31513. It deals with laryngoscopy with vocal cord injection. The next CPT is 31515. It deals with laryngoscopy direct. Previously it is laryngoscopy indirect, all the CPTs. Now it is laryngoscopy direct with or without tracheoscopy for aspiration. The next CPT is 31520. Laryngoscopy direct diagnostic newborn. Whenever laryngoscopy is performed for diagnostic purpose on a newborn, the CPT is 31520. And do not report modifier 63 in conjunction with 31520. The next CPT is 31525. Laryngoscopy direct diagnostic except newborn. The next is 31526. Laryngoscopy direct diagnostic with operating microscope or telescope. And do not report 31526 in conjunction with 69990. The next CPT is 31527. It deals with laryngoscopy direct with insertion of obturator. The next CPT is 31528. Laryngoscopy direct with dilation initial. The next is 31529. It deals with laryngoscopy direct with dilation subsequent. The next is 31530. It deals with laryngoscopy direct operative with the foreign body removal. Laryngoscopy direct operative with foreign body removal. The next is 31531. It deals with laryngoscopy direct with operating microscope or telescope. If the foreign body removal is done by using microscope or telescope, then the CPT is 31531. And do not report 6999 in addition to 31531 because operating microscope is already included here. The next CPT is 31535. It deals with laryngoscopy direct operative with biopsy. The next is 31536. It deals with laryngoscopy direct operative with biopsy with operating microscope or telescope. And do not report the code 69990 in addition to the code 31536. The next CPT is 31540. Laryngoscopy direct operative with excision of tumor and or stripping of vocal cords or epiglottis. Laryngoscopy direct operative with excision of tumor and or stripping of vocal cords or epiglottis. The next is 31541. It deals with laryngoscopy direct operative with excision of tumor or stripping of vocal cords or epiglottis with operating microscope or telescope. If that procedure is done with the help of operating microscope or telescope, then the reportable CPT is 31541. And whenever operating microscope is included in the code description, there you will find this. Do not report 6999 in addition to the code 31541. The next CPT is 31545. It deals with laryngoscopy, direct operative with operating microscope or telescope with submucosal removal of non-neoplastic lesion or lesions of vocal cord, reconstruction with local tissue flap. The next is 31546. If the reconstruction is done with graft, which in this procedure also includes obtaining autograft, then the CPT is 31546. And do not report 31546 in conjunction with 15769, 15771, 15772, 15773, 15774 for graft harvest. And for reconstruction of vocal cords with allograft. For the reconstruction of vocal cord with allograft, use 31599 and do not report 31545 or 31546 in conjunction with 31540, 31541 and 6990. The next CPT is 31560. It deals with laryngoscopy direct operative with arytenoidectomy. The next is 31561. If laryngoscopy direct operative with arytenoidectomy, if it is done with operating microscope or telescope, then report 31561. Next is 31570. It deals with laryngoscopy direct with injection into vocal cords therapeutic. And if the above procedure is done with operating microscope or telescope, the CPT is 31571. The next is 31575. It deals with laryngoscopy flexible diagnostic. And do not report 31575 in conjunction with 31231 unless performed for separate condition using separate endoscope. And do not report 31575 in conjunction with 31572, 73, 74, 76, 77, 78 and 42975, 43197, 43198, 92511, 92612, 92614 and 92616. If the laryngoscopy flexible diagnostic with biopsy, then the CPT is 31576. And do not report 31576 in conjunction with 31572 and 31578. The next is 31577. Laryngoscopy flexible with removal of foreign body. The next is 31578. Laryngoscopy flexible with removal of lesions non-laser. Lesion or lesions non-laser. The next is 31572. Laryngoscopy flexible with ablation or destruction of lesion or lesions with laser unilateral. And do not report 31572 in conjunction with 31576 and 31578. To report flexible endoscopic evaluation of swallowing, to report the flexible endoscopic evaluation of following, you need to see 92612 to 92613. And to report flexible endoscopic evaluation with sensory testing, you need to see 92614 to 92615. And to report flexible endoscopic evaluation of swallowing with sensory testing, see 92616 and 617. And for flexible laryngoscopy as a part of flexible endoscopic evaluation of swallowing and or laryngeal sensory testing by sign or video recording, see 92612 to 92617. The next CPT is 31573. It deals with laryngoscopy flexible with therapeutic injections. Example, chemodenervation agent or corticosteroid injected percutaneous, transoral or via endoscope channel unilateral. The next CPT is 31574. It deals with laryngoscopy flexible with injection for augmentation. For example, percutaneous, transoral, unilateral. The next is 31579. It deals with laryngoscopy, flexible or rigid telescopic with stroboscopy. Now let us see an example. A patient with partial vocal cord paralysis requires bilateral removal of arytenoids cartilage to improve breathing. The laryngoscope with operating microscope is inserted and adequate visualization is established and the arytenoid cartilage is exposed by excision of mucosa overlying it. Here, removal of arytenoids, that is arytenoidectomy, with the use of operating microscope. The laryngoscopy is performed with arytenoidectomy. So the CPT is 31561. Laryngoscopy direct operative with arytenoidectomy with operating microscope or telescope. Coming to next topic, that is repair. The first CPT is 31578. Laryngoplasty for laryngeal web with indwelling needle or stunt insertion. And do not report 31580 in conjunction with 31551, 552, 553 and 554. And to report tracheostomy, C 31600, 601, 603, 605 and 610. And to report removal of needle or stunt, use 31599. The next CPT is 31551. This is out of numerical sequence, hence it is indicated by number sign. 31551. It deals with laryngoplasty for laryngeal stenosis with the graft without indwelling stunt placement younger than 12 years of age. And do not report graft separately if harvested through laryngoplasty insertion. For example, thyroid cartilage graft. And do not report 31551 in conjunction with 552, 553, 554 and 580. And to report tracheostomy, you need to refer 31600, 601, 603, 605 and 610. The next CPT is 31552. It deals with laryngoplasty for laryngeal stenosis with the graft without indwelling stunt placement, age 12 years or older. Previously it is 12 years or younger. Previously it is less than 12 years, younger than 12 years. Now it is 12 years or old. And do not report graft separately if harvested through the laryngoplasty incision, for example, thyroid cartilage graft. And do not report 31552 in conjunction with 31551, 553, 554 and 31580. And to report tracheostomy, see 31600, 31601, 603, 605 and 610. The next CPT is 31553. It deals with laryngoplasty for laryngeal stenosis with the graft with indwelling stunt. Previously it is without indwelling stunt placement. Now it is with indwelling stunt placement younger than 12 years of age. And 31554 is done for age 12 years or older. That is laryngoplasty for laryngeal stenosis with the graft with indwelling stunt placement, age 12 years or older. The next CPT is 31580. It deals with laryngoplasty with the open reduction and fixation of fracture including tracheostomy if performed. And do not report graft separately if harvested through laryngoplasty incision, for example, thyroid cartilage graft. The next CPT is 31587. It deals with laryngoplasty cricoid split without graft placement. And to report the tracheostomy, see 31600, 601, 603, 605 and 610. The next is 31590. It deals with laryngeal reinnervation by neuromuscular pedicel. And the next CPT is 31591. It deals with laryngoplasty medialization unilateral. The next CPT is 31592. It deals with cricotracheal resection. And do not report graft separately if harvested through cricotracheal resection incision, for example, trachealis muscle, and do not report local advancement and rotational flaps separately if performed through same incision. And to report tracheostomy, you need to refer 31600, 31601, 603, 605 and 610. And to report excision of tracheal stenosis and anastomosis, you need to refer 31780 and 781. And finally, coming to other procedures, there is only one CPT, that is 31599. It deals with unlisted procedure larynx. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.